So current mitigation strategies for PJK prevention are really everywhere, and I think it's hard for people to keep track of all the various methods that are utilized to prevent PJK or mitigate the risk of developing PJK. The way that I've organized it in my mind as far as how I think about it and approach it is that there are things that you could do preoperatively for the patient to prevent it. There are things that you could do intraoperatively that will help mitigate the risk, and then there are things that you could do postoperatively. So the preoperative factors could be things such as optimizing the patient, making sure that maybe they undergo preoperative physical therapy and learn proper biomechanics on the mechanical way to move. Perhaps also placing the patient on anabolic agents to improve their bone quality or their overall generalized health and weight. And you could also consider other methods preoperatively to optimize the patient, including significant education, for example, on body mechanics and how to move. Intraoperatively, there are factors that are associated to improve PJK rates, such as really precise alignment targets that are met during the surgery. There's tethering, which is a posterior tension band augmentation that's done through various methods. Also, there's significant focus on intraoperative details, such as proximal rod contour, the type of instrumentation that's used, and sometimes using intraoperative bone augmentation as well with a kyphoplasty technique, for example, or putting cement within the vertebral bodies at the levels above. And the postoperative mitigation strategies are things that you could do with the patient in regards to educating them about precautions. And I like to utilize a hyperextension brace, especially for those patients who undergo surgeries that extend from the lower thoracic region down through the sacrum and pelvis, because the hyperextension brace, I believe, could be really helpful in preventing the patients from going into positions, and it could also educate them sort of like a check rein on the right way to move, for example, when they're doing mundane activities such as brushing their teeth, for example, or picking up a dropped item from the floor.